Okay, so we are live and we are just gonna wait for a few people to join us
Sure.
and give us confirmation that they can hear us and see us both clearly, and then we'll begin.
Sure.
Okay, so you're still at your place of work right now.
Yes, yes, I'm still at hospital.
Oh, so working hard. Has how has the pandemic affected your like work schedule?
Yeah, for 2 months, we only had IPD patients. OPD was off. Later
No.
on, after in July, they started OPD, and now I think the number of COVID patients are reduced too. So it's not much right now.
Okay. Okay. So we do
Much
have
better.
a few viewers. Assalamu alaikum everyone. If you could please mention in the comments that the voice, the audio and the video is both clear so that we may begin. Thank you. Yeah, I've received likes, so I think we can start now. Okay. Assalamu alaikum everyone. This is Rita Zainab from Creative Kinder House, and joining me today is Dr. Haseeb Shah. He is a doctor of physical therapy and masters of orthopedic manual physical therapy. You're gonna have to explain the differences of these two, and he's a clinical physical therapist in Maroof International Hospital. Assalamu alaikum Haseeb, and thank you for joining us.
Walaikum salam. Thank you so much. Okay, my name is
So,
Akisha, and yes, do you have any question right now?
no, I was just saying, can you please tell us about yourself?
Okay, okay, thank you. Okay, so my name is Akisha, and I'm a physical therapist, and today we are more going to discuss about the importance of physical therapy and how much it is important for special children. So
Mm-hmm.
yes, I have done my graduation in Doctor of Physical Therapy. It's a 5 years degree, and then after that I have done my specialty in Masters in Orthopedic Manual Physical Therapy. It is more
Okay.
related to like hands-on techniques in which you treat patients with your clinical skills, and they are more related to your hand-on techniques. Coming to the importance of physical therapy, like we can say all healthcare uh, professions have some limitations. More like
Mm-hmm.
just like if we talk about the medicine and surgery, so they have some limitation, and that's why multiple fields have emerged. Like we can talk about physical therapy, occupational therapy, and speech therapy, behavioral therapy. All these emerged because there were some limitations related to medicine and surgery, and especially they are important for special children. Why
Mm-hmm.
it is so? Because there are people who have problems from their from their birth, and birth problems are always kind of, you can say, it goes to chronicity, and there are nothing much in medical field to do about it, like to treat them completely. So for
Mm-hmm.
this, we used to develop techniques which help them to improve in their daily life activities, and how to reduce the process of those problems.
Okay.
To discuss,
So
yes, yes.
I wanted to ask, like, before we go into everything about physical or physiotherapy, what led you to become a physical therapist? Why did you join this field?
Okay, why I joined this field, because to be more precise, it is much related to kind of physics, which my favorite subject, uh,
Oh.
and in my school life, because the muscles and their power, how to use them, they are kind of very complicated things, and
Mm-hmm.
you have to be very creative to know about the techniques, especially biomechanics, again, the muscles, and how to study them. That's why I got some interest, and I study about it and how it helps to improve the patient. So I find it interesting. So that's why I got into this field.
Okay. So you felt it was more related to physics rather than biology, or like it's
No, no, no.
mixture?
You can't say it is, of course, more related to biology,
Mm-hmm.
but to some extent, it used law of physics, like
Okay.
torque and equilibrium kind of thing. So that's what I can say.
Okay. Okay. So, like you were explaining earlier, okay, what physiotherapy is and why is it important for special children. So I think we should just dive into that. Okay, in simple terminology, if you could, for our viewers, explain what physiotherapy is.
Okay, in simple terms, if I say what is physical therapy, it is actually we promote the health of any person, like or any client who has any disability or any problem in performing his daily life activities or his all other activities he is
Mm-hmm.
doing in community. So we help doing overcome those problems. That's more like physical therapy. Like if someone come to us and he has any physical problem that he can, sorry, some voice problem. I think. Yeah, it's okay
Yeah.
now.
Yeah.
Okay, so that's actually physical therapy. To be in
Okay.
a layman language, if I explain.
Okay. So you said, okay, for anyone who has some sort of physical issues, but still, what would you say? What are the major conditions, developmental conditions or so, for which physiotherapy really helps?
Okay, in the developmental conditions, more physical therapy is helpful in cerebral palsy children or Duchenne muscular dystrophy is a problem in which they help a lot. Other than that, there are Down syndrome. In
Mm-hmm.
autistic children, physical therapy is not much involved because they have not disability problem, but they are more involved in behavior problems. So behavioral therapists and occupational therapists are more helpful for them. But if we talk about CB child or Down syndrome or any genetic mutation in which children have some physical disabilities, then physical therapy help a lot in those circumstances.
Okay. And for so, like we often hear, even parents who have children with autism, they're also looking for physiotherapy. This has often
Exactly,
happened. Like they want occupational therapy, they want physiotherapy, all sorts of therapies, obviously,
of course.
to help their child as best as they can. So, what do you
Exactly.
suggest to those parents? How do you deal with that?
Exact autism, physical therapy is of course important in autism in a way because autism children are always like that they can't interact with the environment very easily.
Mm-hmm.
Like they avoid going for physical activity. So to motivate them and to do them certain activities that help them improve their muscle strength and endurance, that helps a lot. So in this way, we can say that autistic children are important for the physical therapy field, and physical therapy helps a lot among them. So, yes,
Okay. So, can you tell us about how, or should I say, does early physio intervention help children? Like, how
yes,
soon can the intervention start?
exactly. That's an very important question. Actually, I have seen in my life that
Mm-hmm.
there are children who come to me and their parents say that they are involved in physical activities or we are doing their physical therapy session from day one or just soon after we find out that they have developmental milestone problems. So, and then there are other who come to me and they say that we have never done any physical activity or physical therapy session.
Okay.
There is a lot of difference among them. If we compare them at the age of 8 or 10 years old, you can see a lot of difference. The one who is involved in physical activity and physical therapy session, he could be walking at that time and he can be way better than than the children who is not involved in these activities. That's the main thing that I have seen among children because they have parents have issue that nothing is working in the start. They just say that we have been treating them with physical therapist and we can see no improvement. But actually, it's a neurological problem. You can say a brain problem, and brain prognosis are always poor. You can never tell their parents or a patient that you will improve in a days or months or maybe in a year or two. It takes a
Hmm.
long time. So you have to stay patient for that. But then with years, you can see the importance of physical therapy. And when you will see that the child is aging and he goes to a 14 or 15 years of age, you will see a lot of difference in the person who is having a sessions in physical therapy and the person who is not involved involved in any physical activity.
Okay, so obviously it's a long process and it takes years and years. So,
Yes,
like I said, the earliest you can start at age 2, 3, or as soon as the child is supposed to walk.
exact. No, no, it's not about just to walk. The
Okay,
child starts improving, the child starts developing their developing milestones from day one. Like
okay,
within a month or two, they start controlling their head. Like they know how to strengthen their head and they start controlling it. Then further, with as months going on, they start sitting and rolling. These are the kind of developing. Now they are uh, considered by researchers that at each month the child have at least these kind of movements. So it
okay,
has been given, the points have been given. So you have to see the child like that, like at the age of that, at the month of this, has the child got this problem or he still has. So you have to see all these kind of things, that how it is working and how it is not working. Then you have to work on those things. If a child, if at the month of three, a child is not can't control his neck movements, so you have to work on that. So it starts just at the beginning. And yes, the doctors will tell you that yes, he can develop developing milestones at the later stage. So you have to work on
okay, okay. So, like an extension of this question, like you already said, it will take years, and sometimes people can get demotivated or lose hope. कि भाई, we are not seeing much progress or something. So,
it.
how do
Exactly.
you deal with that situation?
Yes, that's an important question. Like how you can motivate their parents. Of course, the child doesn't know much about it. You
Mm-hmm.
have to tell them, and you have to have a session with them, their parents, that, or you can show them videos of different children, that how much they improved at the start. There was nothing at all, but then in when as more with aging, they were improving a lot. So
Okay.
yeah, with the help of videos or with session, with live session, counseling is very important with the parents. It helps a lot. Otherwise, it will be very difficult to treat those children.
Okay. Can you tell us the difference or like expand on both, okay, how physiotherapy is different from occupational therapy? Because in occupational therapy also people work on gross motor skills, and physiotherapy is also working with your muscles. So how are these therapies different?
Exactly. Occupational therapy and physical therapy is quite different from each other. Like in
Mm-hmm.
occupational therapy, they are more involved to improve the fine movements of the children. Okay, and other than that, they work on the patient of daily life activities, like how to pick a glass, how to write, how to do simple things. Uh, but in physical therapy, we have to assess the whole patient demographically. You can say, like, are there any dysfunction or dysmorphology, any abnormal bone formation, or you can say any abnormal movement that we have to assess. All these things have to be assessed, and then further we have to work on it. So they are in this kind of different, like occupational therapists are morely like work on their activities, but physical therapists have to do things in which they become more easy to do those daily life activities. And in that we involve, then we give them joint mobilization and muscle stretching exercises to improve those conditions and to put them, and muscle strengthening exercises. These things help them, and then they are able to pick those classes which occupational therapists teach them how to pick them. But if they don't have that strength to pick the glass, then that would be problematic, and then it would be on us that why we didn't uh, work out on them.
Okay, okay. So the next question I want to ask is, like in the beginning when the therapy is about to start. So what's the process basically? What's the best way to start? What do you do? Can you tell us a little bit about your process?
Okay, again, as I just mentioned that there are developing milestones of every
Hmm.
children. we always mostly we assess the patient with those developing milestones, that have they developed those milestones or not. If they haven't, then you have to work on those developing milestones, and you will you have to try to achieve them. It has to be done step by step,
Mm-hmm.
just like milestones are developing step by step. So you have to work on it. So the best thing is first to assess the patient, assess the children or the client, that how he is managing those milestones. If it is not working, you have to mention them and put them on points. And then further with the age, you have to relate it with their age, and then you have to work on each developing milestone time to time. And then you have to counsel their parents and tell them that how important it is for them to reach those milestones, and work on them. Because again, it's a neurological problem, and just a session with me for an hour won't be enough for the children. So you have to give session to their parents too, and tell them that you keep working on them every time when they are at home with you.
Okay, okay. Can you tell us about a few sources or resources that if people are at home and want to look up on physical therapy, so what are the credible sources?
Sources like what? Like to discuss with someone?
Yeah, like if people want to know more about physiotherapy, like even if parents are researching for their own children, so what should they look up?
Yes, I think they can contact you, and you have my contact. So yes, they can talk to me anytime, and I will give them uh, whatever they have any problem, and I will discuss it. That won't be a problem.
Okay, okay. So I've also received a question about orthotics. How do you know if your child needs? I'm not sure about this term.
Okay, okay.
Orthotics.
Yes.
Yeah.
So, yeah, orthotic is very actually important, but yes, there are recent problems I have seen in orthotics too, which I also want to discuss. Like orthotics is involved when the structure of body is not normal, you can say. Like we see
Okay.
that how a normal person can walk, or a
Mm-hmm.
normal person places his steps. Especially a child needs foot orthotics. That's what we have seen mostly. So if I talk about specifically about that, so we can easily say that about a weight training, that how a child should walk. So if a parent see that yes, there is some problem in his walking, then they can come to a specialist orthotics, a procedure and orthotics, and talk about them that he is walking like that. He can assess him. Even a pediatric surgeon can assess that child, or even a physical therapist can assess that child. And then we can prescribe orthotics to them to help them move easily. It also helps to those deformed structures which we are talking about before, that they could be abnormal. It aligns them back to its original position to some extent, sometimes complete. So it helps. But yes, there are some few orthotics which are very hard. The structure is very hard of those orthotics, and what it does that it put extra pressure on the bones. And when we find out that when we assess them, then we see that those extra pressure exerted on those bones deforms the foot for even more. So that's kind of a problem a little bit for orthotics. So whenever you use orthotics, you should be very careful about that, to use them efficiently, and it won't damage the child further.
Okay. Uh, I would like to ask if you would share, like you've had more than 2 years of experience and you would have dealt with many cases. So could you share a tough case with us?
Uh, a tough case. Yes, I see a patient nowadays. He comes to my department.
Mm-hmm.
So he has that problem. He was a TP child, but yes, they were doing physical therapy from very day one. So he has improved a lot. But
Okay.
recently, because of the extreme deformation, he has to go for surgery, uh, just to improve his bone formation, or put it in the right structure, if I can say. Then after that, physical therapy is again involved in that circumstances, because you have to teach the children that how to walk in this position right now. because now it's a normal position, but for a child, it's not a comfortable position.
Mm-hmm.
So now that child is coming to me and I'm giving session to him. He has improved a lot. He was actually walking with in toes. So now the things are getting better and he is walking on his own and it's very happy. Yeah, it's been almost 2 months, but
Okay.
it's working.
Saleh, Alhamdulillah, we wish him all the best. So now I want to ask for people who might be considering this field for their future, what can you say to them? Like, I'll break this question into parts. What do you think makes a good physiotherapist? ठीक है. Why should one become a physiotherapist? And yeah, let's answer these questions first.
Okay. Actually, it's all about passion. Like if you know that you can do it, if you know that you can have that patience and you can wait for children to recover. Like
Hmm.
there are some subspecialties more into pediatric physical therapy, and then they are specific to only children. That's what you find out with best of time, that which kind of field you are more interested in. It. There are further specialties that cardiopulmonary physical therapy, in which you treat patients with heart problems. So with the passage of time, you find out that which field is more uh, interesting for you, or you can do more in that field. So that's the kind of thing. Uh, so it's more like a passion, I can say. It's not about
Hmm.
that why you should go into it. If you really think that that's the kind of field that you can do it, because it's a complex, you can say a very creative field. Like you, and there are a lot of spaces for you to fill them in. So it's a new field, it's an emerging field, especially in Pakistan.
Yeah.
Like I'm working with you guys, and we are treating children to find out about such loopholes, how to cover them, and you want to do, you can become an entrepreneur in this field. So yes, that's these are the things. If you really want to do that, then you should become a physical therapist.
Okay. Uh, and thank you so much for joining us. In the end, I want what advice can you give to the parents? Any piece
Can
of
you repeat the
advice?
question?
I said, any piece of advice you would like to give to the parents?
Yes, of course. I really want to tell them that at least, yes, because of this COVID situation, don't ignore your children. It's there. At least do some physical activity for them, and you can easily find out that they have this abnormal movement or this abnormal variation. You can work on it at home. If not, then at least or any physical therapist who can give them home session, it can be helpful. So these are the kind of things I want them, that don't neglect them. In the starting age, it is very important, because
Mm-hmm.
what happens that if you delay it, the child start considering that abnormal position he is doing as a normal position. So then we have to work further on it, and to put that abnormal position back to normal position, and then we teach them that normal position, and then it takes a lot of time. Like you can say so. If you do it from the very start or very beginning, it helps a lot, because the child has not considered that abnormal position as a normal position, and we can do directly teach him how to be in that normal position and do your daily life activity. So yes, that's what I want to say. That don't neglect them, and it's very important for
Definitely, because like all the other therapies, they say that if a break comes, so a child may regress. So you need to make sure that you're
exactly.
consistent. So in physiotherapy as well, regression would
Of course,
happen.
you have to be consistent, especially for those children.
Okay, okay. So thank you so much, doctor, for joining us today. It was a pleasure
You
to
are
have
welcome.
you. Okay, thank you. Allah Hafiz.
Thanks. Allah.